Hello, thank you very much for inviting me. So, a bit about my background. I am community nurse by background, so I worked in the community in Marie Curie. I was then working as a senior nurse, as a practice development facilitator before moving to the role of the research nurse, so kind of building this range of experience along the way. And within this presentation, I want to tell you a bit about the challenges and set up the context of what Marie Curie does in terms of research, and then how we responded to the challenges in establishing research in a hospice, but also in the community hospices, and then a bit of learning along the way. So briefly, we actually are the leader of palliative care in UK. We fund the majority of the research in the UK, but we also deliver research. We enable research to happen in our hospices. We involve people in shaping the research, and we use research to drive the change. I'm not going to go into the details, but just wanted to highlight that we've got 4 thematic areas that we fund. At the moment is mental, and they're focusing on mental and physical health and well-being. And that's not only the patients, but I mean people affected by death, dying, and bereavement. So it's patients, their family caregivers, their friends, their formal caregivers, staff. Okay. Secondly, to end financial insecurity and the end of life. Then to ensure that everyone affected by death, dying, and bereavement is supported through the end of life and into the bereavement. And to end inequality, because we know there's some people have easier access or better care than the others. I think Professor Christina Fall already mentioned this publication. So the publication is from 2013. Those are some of the barriers highlighted in that publication, and I think they kind of still quite match to what Mary was saying currently, and they probably will match quite well also what Professor Catherine Walsh will tell later from the UK perspective. So, what have we done in Marie Curie? Okay, because as a research nurse, I help to overcome those challenges into establishing research in practice in the hospice. So my role has been introduced in Northern Ireland in Belfast Hospice in 2021. However, first research nurses were in England in 2016. So initially those posts were secondments, so part-time temporary secondments for people who were in clinical practice, who were moving to this role. However, over the last few years, all the recruitment have been for permanent contracts, because organization has realized what are the huge benefits of actually having this, like you said, clinical practitioner, research practitioner who actually has protected time for research. So we are, as a research nurses, I will go between me as a research nurse and actually us research nurses as a group. There's 5 of us at the moment across the UK. We're embedded within the clinical teams. And by clinical teams, I mean the hospice team and the community. We're working in places, but we're part of the central research team. So we've got big infrastructure behind us. We're working alongside policy and public affairs team. Our teams are in the same directorate, so there's huge opportunity to learn, but also develop research that will be influencing policy, and vice versa. Each of us is supported by academic mentor. Marie Curie has established network of research fellows, and Dr. Tracy McConnell there was my mentor throughout the last few years. She had a joint contract between Queen's University and Marie Curie, and it has been hugely helpful to actually work with the academic in that context. Then I just wanted to touch about central research governance, because as I said, we've got this huge research team in Marie Curie, and over the last few years we have developed clinical governance. we've got kind of like a two-tier system. So we've got central governance, and you will hear later from Gurmel, who will tell you a bit more about that. When all new studies we want to recruit from our services will come for approval to Gurmel. However, in the locations, in the hospices, I will do local capacity and capability assessment. So I will link out with practitioners who will be affected from those services that the recruitment will be taking place, and really assess, details of what is required from us as a hospice, and how can we facilitate this recruitment to happen. So why clinical staff in a research role? Okay. Communication skills with, when you need to consent patients to studies, that's kind of quite obvious. We are clinically competent. And actually, even in situation, we had a study that last year that I've had to have patient handling training, because I had to ensure physical safety of participants while they were completing some physical exercises. But there's also this thing between insider and outsider. And unfortunately, researchers from universities are often seen still as outsiders. They are not part of our team. They don't get us. They maybe don't get the challenges. We are very busy. We've got all those, clinical pressure points. I was based kind of within the hospice team, and able to sometimes connect with practitioners, and when we've got studies, really translate sometimes even the language and what is required from the study into this easily understood language that we practitioners just use on a daily basis. But there's also something about reviewing protocols, and ideally we would really like studies, researchers coming to us if they want, for example, if they plan the recruitment from Marie Curie sites, to come to us at the study development phase. Because we had situations that when the study came in, some of the things we were not really very happy with. Some of the participant information sheets were not something that we would be happy to share, and that caused some issues then along the way. So more recently, we had studies coming in and actually developing those projects with us and involving our practitioners to co-design those projects. And I do have protected time for research. Okay, I don't need to fit research within my clinical role. I do research as my main role. Okay, which is hugely helpful. So briefly, our main partners really at the moment in Northern Ireland are Ulster University and Queen's University, and I know it maybe didn't come clearly in the data previously, but we actually had, I think, 8 or something active projects within last 12 months. Not at the moment. I think we're strangely quiet. We actually don't recruit at the moment for anything. But just from the center going clockwise, so see the gentleman with the VR set. So that was a very interesting project that was combining behavioral activation, so a type of talking therapy using the VR sets. And I was involved in joining those group therapy sessions and actually then standing behind the patient when they were doing those exercises with the VR set, but also provided critical feedback on development of the interventions and doing all the admin, room booking, and so on. So it's quite a wide scope within this project. And we're actually now taking that on and developing a research impact funding application, because we want to purchase those sets for the hospice now and implement them into the daily practice for all patients in the hospice, supported by physiotherapists. We also recruited to James Lind Alliance Priority Setting Partnership Refresh, and that was led by some researchers in Marie Curie with James Lind Alliance. And this painting there, actually, that's from my own study. So I led recently on the study. We're looking at healthcare assistant well-being and how those who are working alone in patients' home, and how does it impact on the retention. As we know, the retention is actually quite a big issue at the moment in health and social care settings. And one of the main results that came up is that they feel very much invisible, they feel undervalued, and that the role is not understood. So I commissioned this piece of art that we are using now for dissemination to highlight the role, to highlight some different elements of the role in a slightly different way, not just publishing a paper and talking about it. We also had studies about loneliness among people with terminal illness and about social support intervention. And I think we recruited to Kevin's study there about digital advanced care planning, resource development, and other few studies. So there was quite a number of them over 12 months. So when we talk, I think Mary was talking about research culture. What I found, this was actually my main duty within a hospice. Over the last 3 years, that was my main focus, actually trying to engage with practitioners. And don't get me wrong, it's very slow, it's challenging, but to develop this research culture, that the research is present, that we're actually using research, that we're talking about research, and that we recruit to research, and so on. I was facilitating dissemination, so things from putting posters on the corridors to actually facilitating webinars and live streaming conferences, virtual conferences in the hospices with snacks and goodie bags and things like that for staff. I supported our practitioners to actually write abstracts and present at conferences, and not only clinical stuff, but we also actually had a poster from a chef from the hospice who was presenting about the role of catering staff in holistic hospice care for patients. And there's research delivery. Research delivery and links with academic institutions and PPI partners. And I think I'm not going to go into the details, but in relation to research delivery, in Northern Ireland only, between April and March of last year, I've recruited 55 participants in study, that's between patients and staff and carers, but also additional 200 over UK for one specific study. And among 5 research nurses, we actually recruited over 6,600 participants in 12 months. So I think that's quite an impressive number when you think so. Yes, there is this qualitative element and things that are very difficult to measure, but this is a number that actually tells a big story there too. And also research nurses are developing as nurse researchers, okay? Initially, each of us, when we started, none of us had research skills really that developed. We have not done studies. Now, out of 5 of us, 3 of us already done research projects, and 2 further are applying for research grants to actually do their own research. So that having this role actually really helped the practitioners develop into researchers and develop those small projects that are coming from practice and building the evidence for palliative care. Challenges. It's definitely not a sprint, it's an ultramarathon, okay? Building research culture in hospices takes time. Managing various responsibilities and collaborations while actually working quite autonomously is challenging too. Research governance, okay? This is unresolved and something that really bothers me. When we had studies, we've got very few studies involving patients in Northern Ireland, in our hospice, okay? We had studies where recruiting patients and staff in England, Scotland and Wales. When they came to recruit from Northern Ireland, they only recruited staff because of ethics requirements. There are different ethics requirements in Northern Ireland than the rest of UK, and that we have highlighted that, but it shows that we are losing this voice of the patients. We don't hear it. And I think over the last 3 years, I think I can count 3 or 4 studies that the same situation have happened. Research nurse role is expanding, and it's been expanding because our knowledge and skills have been expanding, and we've been taking on additional responsibilities. So I think just last week I've been doing a quick, rapid review of evidence for our policy director, and I don't think it's in a role description. And I already mentioned that we are developing those academic skills to become nurse researchers. And the challenge with that is that we now need to recruit to my post, because from September I will be starting PhD. So yes, thank you. And yes, that's me on the picture, finishing my first ultramarathon just previous weekend. And there's definitely some similarities between research nurse role and ultramarathon. So definitely pace yourself, learn from experts, and get the support network around you, because there are challenges, but research nurse role over the last few years have been the most challenging and fulfilling role I've ever done. So thank you.